Hello, welcome to another tutorial section for the medical office software. In today's video, I'm going to take you through the clinical consultation. So currently we are on the home page. We go to the clinic section, and then under the clinic section, we go to the clinical consultation. Okay, so the page is loading. Okay, so we have the page loaded. So this is the clinical consultation page. The first thing we normally do is to load the patient's detail, and you can do that by keying in the patient's number here. There's the search with ID section where you can search with the patient's number, or you can also load the details by double clicking. You can load the details by double clicking on the patient's name. So in this case, let's say we are dealing with Stephanie. So let me just double click on Stephanie's details. Wow. So now, depending on how we configure the system, it's either the patient pays for the consultation bill before going to the consulting room, or the patient can go to the consulting room before going to pay. But with this current configuration, the patient is supposed to make payments before visiting the consulting room. And for that matter, we can't continue with this unless we go back to sorry, unless we go back to clear the bill. So let's do that quickly and then we come to continue. Okay, so welcome back. Now that the bill has been cleared, let's try and then load Stephanie's details by double clicking on the name. All right, so now it's giving us a caution that this is a cash and carry patient, so you will just click OK. Now, anytime you search for a patient detail on the consultation page, this pop-up view will come. We have the identification section, which has the folder number, the name of the patient, the gender, and then the age. We have the notes, the vitals note section, which has the temperature, the BP, and then any other notes that is from the nurses. Okay, and then at the last part is the alerts portion. So in case the patient is hypertensive, in case the patient react to a certain drug, any information that other clinicians needs to know, and it's important, you can put it on the alert section. Okay, so after previewing the pop-up, you just have to click on this button, okay, and then it goes away. Okay, so now back to the page. Now this page has a number of sections. By default, the patient index is what displays first. So this is the patient index portion. You can go to other section by scrolling through the page, or you can use these navigation buttons. Okay, so we have these navigation buttons both in the middle and at the bottom of the page. So the next one is the vitals, the medication, the clipboard, the general history. Okay, so back to the patient index. We also have the diagnosis section. We have the past diagnosis, labs, imaging and stuff. So this is the clinical notes section. So you can normally type whatever complaint the patient comes with here. You can format it, you can bullet it just by highlighting, and then you can do whatever you want to do with the text. It's just like a word page. You also have the examination and findings tab here, and then we have the procedure tab too here. Okay, so in case you want to give some prescription, you use the medication, go to the medication section, and then you can type or you can search for medication here. You pick the medication and then you load the dosage. We also have past medication here to allergic tab 2. In case the patient react to a certain drug, you can put it here for other clinicians. There's a section where you can also search for the drug using these categories. Okay, there's the diagnosis section where you can search using the ICD-10. Okay, or you can key in your own diagnosis here. You have the past diagnosis. You can send for lab requests from here. Okay, so you pick the request and then the bill is generated. Okay, you can view past labs here, so you can see a number of labs that has been done. When you want to preview the labs, you double click here, and then there's how the lab is presented. This particular report has a number of labs, FBC and many other labs on it. Okay, we have the imaging section where you can also request for maybe a scan or ultrasound or whatever. You pick it, the bill is generated, and then you send the request to the unit. Okay, so you have the past images to here. So this is just a simple interface for consultation. You can also request for admission. There's the admission request button. So you can also request for admission for your patients. Okay, okay, so finish and then you can send. All right, you can also attach images. Okay, so there's a vital section. You can attach, upload files and upload images or other things. And then we also have the appointment list. Wow. So the appointment list will give you a list of all patients that have been through to the consulting room. Those that um, have been attended to would have the green tag. So here you can view the patient registration details here. You can view the past history to here by double clicking on the name. Okay, and then in case you also um, um, put a review note. Okay, if in case you ask the patient to come back on a certain day, or in case a patient is booked for a certain day, you can view those patients by clicking on the review appointments. Okay, so when you click on the review appointments, it gives you all the clients that are supposed to visit the facility on that day, depending on the review date that you have set. Okay, so there's also a very important section. So that is the appointment list for you. Okay, so this is the page. Back to the index is a very simple page. You can view past visit history using this attendance history section. You can do that by just double clicking on the date, and then you can see all the history and everything that was done on that day. You can also view other visits dates. So um, access to past or previous history is very, very simple and easy to get. So what again? I think I've touched almost every part of the page. This is a very simple page. I believe you've learned a lot in this video, and I hope you have enjoyed it. Thank you very much.